Hello, I'm Andre. I'm Dr. Andre Ray. I'm a clinical psychologist as well as the IBH team manager. I've been with the IBH team for 2 years and with the Indian Health Board for 4 years. As a psychologist, I'm often asked by the medical team to meet with patients who are struggling with mental and emotional difficulties. I conduct brief assessments and interventions during medical appointments to better understand patients' struggles and how to improve their mood, including depression and anxiety. These meetings tend to be brief, lasting about 15 minutes. We focus on the here and now and practical strategies that might help. I also conduct follow-up visits as needed, often through telehealth, and make referrals for long-term therapy for those interested. In addition to depression and anxiety, I also meet with patients about grief and loss, trauma, alcohol and substance use, as well as smoking cessation. For those patients interested in smoking cessation, they can meet with medical providers for nicotine replacement products and can meet with me to create a care plan. This involves shoring up motivations, identifying triggers and alternatives, develop skills to rout out urges, and build coping skills to deal with stress. I'm honored to be part of your care team here at the Indian Health Board.
Hi there, my name is Dr. Ratty and I recently completed a postdoctoral fellowship with the Integrated Behavioral Health team here at the Indian Health Board of Minneapolis. After completing fellowship, I'm staying on as a school-based psychologist who will be providing psychotherapy and support to children and teachers at the local schools, including Anishinaabe Academy and Sanford Middle School. As part of my fellowship in the medical clinic, one of the important responsibilities I had included administering the Ages and Stages questionnaire for our pediatric patients. This is a developmental screener that is used to highlight the developmental progress in children between the ages of 1 month to 5.5 years. The screener measures communication skills, gross motor skills, fine motor skills, problem-solving skills, and personal social skills. The screener highlights the child's strengths as well as areas that they need additional support. It is administered to parents in the clinic, after which the child's pediatrician will go over the results with them. In the event that a child falls in the monitoring zone, parents will be provided with additional resources and referrals that will allow them to further provide support for their child. Parents are also provided with intervention activities for them to practice with their children in the areas that they need more support. Over my time here, I've observed that these intervention activities tend to take a much more westernized approach. As part of my postdoctoral project, I've been working closely with Native elders within the community to adapt the intervention activities to incorporate more Native American cultural activities that parents can do with their child. With that, I am truly honored to be part of your care team at the Indian Health Board.
Hello, I'm Micah Purichikan. I'm an enrolled member of the Oglala Lakota Oyate, and I'm also Sichangu Lakota and Minneapolis Dakota. I was trained in clinical psychology at the University of North Dakota. I'll be the postdoctoral fellow on the Integrated Behavioral Health team during the upcoming training year. I've been with the Indian Health Board at the Counseling and Support Clinic as a predoctoral psychology intern over the last year. I'm looking forward to broadening my training with the Indian Health Board in the medical clinic. Keeping in line with the goals of the Integrated Behavioral Health team, you may be seeing me around the medical clinic over the next training year. I'll be conducting brief psychological assessments and interventions with individuals who may be struggling with emotional and behavioral health difficulties. A large portion of my training up to this point has focused on helping Native teens and adults work through depression and anxiety. Additionally, I have interests in 1, how Native folks effectively cope with high levels of stress, and 2, evaluating how organizations such as the Indian Health Board implement health programs. Combining these interests, I'll be working closely with the Indian Health Board's Indigenous Services Program to provide the best services that we can to the community. I'm honored to be a part of your care team at the Indian Health Board.
Hello, my name is Jacob Kronenbergs and I'm a care coordinator for the Integrated Behavioral Health team. I'm a descendant of the Turtle Mountain Band of Ojibwe. I assist patients who come into the clinic who may need employment, housing, food, or other material needs. These types of resources, among others, are known as the social determinants of health. Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. As part of my work in the clinic, I administer the Prepare form, which helps screen for unmet needs that may not have presented themselves in a clinical appointment. We also screen for patients' needs that can be addressed at the appointment, like providing traditional medicines, including sage, sweetgrass, cedar, and tobacco. If counseling services are discovered to be a need of the patient, I can place the patient on the counseling wait list, or even bring in a behavioral health counselor to meet the patient if the need for counseling is more immediate. In the community, I assist with physical health, providing online Zoom classes for martial art movement classes, as well as collaborating with Indian Health Board's health program to run chair exercise classes for patients who are learning to manage their diabetes, as well as working with the elder population. More recently, I've been assisting patients in applying for rental assistance through the RentHelp Minnesota application. I also assist patients with other paperwork that they may have to address their needs outside the clinic, such as scholarship applications, daycare, and housing assistance. I'm happy to search for the solutions to our patients' problems.
Hello, my name is Linda Roberts, RN, a care coordinator in the Integrated Behavioral Health Program. I have been working within this program for about 3 years. As a care coordinator, I provide direct patient care by assisting with integrated behavioral health services into the primary care setting, promoting the prevention and restoration of health for our patients. Some of the activities I do are coordinating care, providing education and follow-up as needed, facilitate referrals to specialty services, and support to promote smooth transition. I've also had the opportunity to work directly with our psychiatry provider within this time. We are currently in between psychiatric service providers. However, we will be happy to resume our collaboration with our patients' psychiatric needs once our new provider steps into their role. I'm also honored to be a part of the Integrated Behavioral Health team. Thank you.